Hello everyone. Hospital and healthcare service providers, as well as the doctors, are one of the most important component of providing healthcare services in our country. Not necessarily our country, entire world. What we have seen in India is a significant shift in the healthcare. It was COVID and the pandemic which really gave an impetus to improvement in the healthcare. India has a very interesting healthcare services. Significant amount of healthcare services fees are paid out of pocket, considering the insurance coverage very low compared to other countries. What we are seeing today is significant changes the way hospitals operate, the hospitals behave. We have seen one technology coming in a big way in healthcare services and hospitals. We are seeing consolidation happening where two hospitals of different disciplines come together and join and make a big hospital. We are also seeing the trend of bigger hospitals acquiring smaller hospitals. And the last, we have also seen in our experience that private equity players have a significant flavor for making investments into either single specialty or multi-specialty hospitals. So why this is happening? Because there is a need to improve the infrastructure. The healthcare services provided in India is perhaps the best. That is why India is one of the most important and popular hub for conducting clinical trials in India. But in doing so, the gap between private setup and a corporate setup is not widening. Rather, it is getting thinner and thinner. But in fulfilling this entire trend of consolidation or acquisitions or private equity investments, are hospitals ready? The healthcare providers like hospitals and doctors are covered by certain regulations. It is important to know how the liabilities happen, how liabilities can be combated, how important the compliance is, so that the hospitals are ready for such shift or a paradigm shift in the entire business model. I have my colleague Eshika Phadke who will talk to you about entire healthcare and hospital and doctor sector on liabilities, compliance and being ready. Thank you, Eshika.
Over the past few years, there's been a flurry of activity in the hospital industry. We've seen a market rise in both consolidation as well as private equity flowing into the sector. Because of the decentralized nature of healthcare services in India, there's been an interest in setups of all sizes and specialties. What we've seen in the last year or so is that hospital chains are increasingly acquiring mid-sized hospitals in non-metropolitan cities to increase their geographical footprint, while PE investors have been showing interest in niche single specialty practices. Irrespective, the key question that investors and potential targets alike have had is how to minimize the risks and optimize patient safety. Hospitals tend to be inherently complex and risky businesses, not only because they're literally dealing with life and death on a daily basis, but also because the operations are heavily regulated and highly prescriptive. Hospitals in India are required to obtain and maintain a web of permits from various regulators to operate. There are conditions and compliances linked to each of these permits, and non-adherence to any one of them could result in the license being suspended, which in turn could have a domino effect and potentially halt operations. Separate from the licenses, there are a number of legal and ethical requirements that guide, or sometimes even dictate, clinical practice. For instance, when to obtain written consent, how much to tell a patient to support their decision-making process, best practices in terms of documenting patient records, how a patient may be referred to a different facility or even a different specialist within the same facility. Additionally, hospitals may also be made liable for any negligence committed by their staff. Over the past decade or so, patients have become increasingly litigious, and there have been a slew of decisions and heavy penalties meted out to doctors and hospitals. As a result, the quote-unquote industry standard for administrative legal operations at hospitals are constantly evolving. Now, what does this mean for hospitals that are looking for investments, looking to get accredited, or otherwise striving to optimize healthcare quality and patient safety? First and foremost, aligning internal policies and processes with legal best practices cannot be treated as a one-time activity, and hospitals should undertake a detailed review on at least an annual basis to assess what is working and what may be improved. A hospital that is being evaluated as an investment prospect would mandatorily undergo a detailed due diligence. To preempt any unfavorable findings at such a stage which would affect the valuation, hospitals should regularly undertake compliance audits spanning across their operations. Given the increased focus on quality, hospitals should assess how they can go beyond the minimum requirements specified under the law to use it as a tool for improved patient safety. Another risk factor for hospitals stems from the fact that they may be held liable for any negligence or deficiency in service committed by doctors associated with the hospital. In such an event, a hospital may substantially strengthen their defense if they can produce evidence that no fault may be attributed to them. To this effect, hospitals should put in place written protocols and standardized processes across operations and provide all personnel with adequate training. Audits, both clinical and documentation, should be conducted periodically to ensure that the staff is adhering to these protocols and the hospital is in a position to demonstrate that. Globally, antitrust or competition regulators are growing increasingly vigilant when it comes to the healthcare industry. Practices which were previously considered the industry standard are now being considered anti-competitive. Hospitals should consider auditing all the activities to identify if any modifications are required. To sum up, yes, legal compliances may be cumbersome and time-consuming in clinical practice, but they may be used as an effective tool for improving patient safety and quality of care, and ultimately for improving the valuation of the organization. So that brings us to an end to today's podcast. Thank you so much for listening in.